Hello, everybody. Welcome. While we let everybody come into the Zoom, if you could go ahead and participate in our poll so we know who is joining us today. And we'll get started in just a minute. Thank you all for joining us. We're going to get started in just a second. We're just letting people join the webinar. If you haven't already done so, if you could complete our poll so we know who's here. Thanks so much. All right, I know some people are still jumping on, but I want to be mindful of everybody's time, so we're going to go ahead and get started. And first, I will end the poll so you guys can see who all is here. Looks like we've got a really good array of people joining us: attorneys, social service providers, survivors, survivor advocates, students, mental health professionals, and community members. Thank you all so much for being a part of today's webinar. We are so thrilled to have you. Oh, it looks like I didn't share the results. There we go. Now you guys can see it. Thank you all for attending today's webinar. I'm really excited about this. This is at least the third time that I've heard Dr. Greenbaum do this presentation. And I will say that I learn something new every single time. Being trauma-informed is something that it's not something that you can just take a course on one time and then you're trauma-informed. It certainly is it's the starting point, but it's something that you have to continue to both develop your own skills in being trauma-informed and continue to look for opportunities to learn about, skills, practices, techniques for being trauma-informed. So I'm always looking for those opportunities. I'm really excited to share this opportunity with all of you today. And really just absolutely thrilled with the response we've had to this. So clearly I'm not the only person who likes learning about this subject. And for the lawyers on this webinar, we have a lot of attorneys on here. This is something that I'm really passionate about educating lawyers about, because it's something that we don't learn about in law school. I don't know, I hope that some of you learned about trauma and trauma-informed lawyering in law school. It was not something that was a course at my law school and is not something I've seen very much of. You may in a clinical setting or in some classes maybe get a little piece of, but this is something that the vast majority of lawyers, maybe leaving out transactional lawyers in a few practice areas, most lawyers are going to interact with people who've experienced trauma, trauma victims, trauma survivors, and this is a skill that we can all develop and cultivate within ourselves and our practices. So with that, let's go ahead and jump right in. Brittany, if you could go to the next slide. Thank you. Just a few introductory housekeeping things. First is, if you are not already in speaker view, you can do that on the top right corner of your window. If you have any technical issues, please reach out to our training coordinator, Elaine, and her contact info is there. And for all the participants, just so you know, we can't see you and you're muted, so you can feel comfortable with that. And finally, we'll do a Q&A at the very end of today's webinar. And if you have any questions along the way, we want to be mindful of everybody's time and get you to finish right at 1 o'clock. So we will wait till the end for questions so that we don't run out of time for them. So if you can, ask your questions along the way and we'll get to them at the very end. And we are available to stay a little bit longer after. So even if some people have to jump off at 1 o'clock, we understand, but we'll stay a little bit longer to answer your questions. Next slide, please. So for those who've attended our webinars already, you'll know that I love to just take a deep breath at the beginning of each of our webinars just to ground ourselves down and so that we can be present for the next hour. So if you're comfortable doing so, close your eyes. If you're not comfortable closing your eyes, then feel free to lower your gaze and just take a long, slow, deep inhale through your nose and a longer, slower exhale through your mouth. All right, let's begin. So today's speaker is Dr. Brittany Greenbaum, and she is a staff therapist at the University of Iowa. She completed her doctoral dissertation on the mental health of survivors of sexual exploitation and is in the process of publishing several papers on that topic. And she is certainly an expert in this field, and I'm looking forward to hearing from her. Today, Dr. Greenbaum is going to start off giving us an overview of trauma's impact on our bodies, and what it means to be trauma-informed and how we all can be trauma-informed and give us some tools for that. At the end, I will speak to trauma-informed lawyering specifically, and we'll conclude with talking specifically about how we can be trauma-informed during COVID. And with that, I'm going to turn it over to Dr. Greenbaum. We'll take it from here.
All right, thank you so much, Jamie. Like she said, I'm Dr. Brittany Greenbaum. I'm really happy to be here with you all today. And as we are starting this presentation, I want to take a moment to recognize that we are going through a global trauma right now all together, and we're all having varying degrees of impact from that. But what that means is that all of our nervous systems are more taxed right now, and we're therefore more susceptible to acting from places of harm within ourselves or being a little bit irrational and struggling. So I hope that you're all being very kind to yourself. I hope that you're being kind to your family, that you're tending to your pain so that you can bring your best self each day into the work that you're doing to support survivors. And thank you all for the work that you're doing. So that being said, I'm hoping today's presentation is going to be a little less personal and more objective, so hopefully it won't be too triggering to anybody. I'm hoping to give you a lot of concrete information to help you better understand how trauma works and how we can live after atrocities. So what is a trauma? A trauma is essentially a very negative event that we go through. It's to an extreme. Some examples of trauma events include physical assault, sexual assaults, childhood abuses, domestic violence, terrorism, military combat, natural disasters, man-made disasters, car accidents, witnessing murders, death, seeing body parts, and even, like I've said before, being in a pandemic. We have nurses and doctors and janitorial staff and people all over on the front line right now, and people are being affected by what's going on because it's an extremely negative event. And trauma has distinct physiological effects on the brain, which can affect our ability to function short-term and in our long-term life. So a trauma response is essentially how someone reacts in response to that event. And about 70% of the population will experience some kind of traumatic event in their life, but only about 1 to 3% will go on to develop PTSD. Let's go to the next one. So what happens during a trauma moment? I think this is really important to know because it can build empathy towards understanding what your client went through and why it's so important to be mindful of their experience while you're doing work with them. So during a traumatic moment, our body gives us awareness that there is danger present. It uses our 5 senses to tell us something's not right in our environment. Our brain then starts to assess the level of danger, and it only is going to send energy to the areas that are vital to survival. So this means my heart's going to start beating faster, my lungs are going to expand, my pupils are going to dilate, but my ability to think rationally and to think clearly isn't going to be very well functioning. So when I'm stressed out, it's not important, or if I'm threatened for my life, it's not important that I know that 2 + 2 = 4. It's not important that I know somebody's hair color. What's important is I see where the door is and I get my body moving in that direction as quickly as possible. So in that moment, our body is going to release a lot of fear-activated stress chemicals and hormones. A lot of adrenaline and cortisol are going to be released through our body in order to help us respond. And our body is going to automatically move into its natural response for the situation. So we instinctually kind of have a fight, flight, or freeze response in our body. Either I'm going to try to attack the trauma, whatever's coming at me, I'm going to run from it, or I'm going to stop in my place and not respond to it. We don't have control over this. Like I said, it's automatic. So in these moments when people try to blame others for their response in it, they actually didn't have a lot of control. Their body is telling them what they need to do to get through that moment. And while it is an automatic response, there is some evidence that with significant training, we can help ourselves learn to respond differently, but there is no guarantee in that. So after experiencing a trauma, regardless of what kind, people tend to experience depression most frequently. While we talk about PTSD as the most common symptom of a traumatic experience, depression is actually the most common thing that we see in people, a sense of hopelessness, helplessness, worthlessness, inability to find meaning in their life after such an intense experience. We see a lot of anxiety, a lot of jitteriness, a lot of hypervigilance, and people who experience trauma often have the image or the memory repeating in their mind over and over again as their brain is trying to make sense of the experience. So your brain is trying to put this really horrific event into some kind of context of understanding, and that's very hard for your brain to do. So it's going to get stuck in short-term memory for a little while. And in addition to that, it's going to keep giving you this information because it's trying to help you not end up in the same situation again. While the symptoms of trauma and PTSD are very painful, they're actually trying to help you, which is, I think, really important to remember. Your body doesn't want to keep telling you this to cause you harm. It's telling you this over and over again to say, hey, let's try to be aware of anything that happened within this moment so that we can try to avoid it so we don't have to get into that situation again. But if my brain is continually giving me all this really negative information about this experience, I'm going to probably start to avoid some of the things that maybe trigger it. This could be locations, this could be people, smells. It can be really anything that you associate with the trauma in that moment. I've heard stories of somebody being assaulted in a parking garage while wearing a yellow shirt. And for some reason, their brain latched onto the color yellow. And when they would see yellow, they would start having trauma symptoms over again. And that would be called a trigger for them, which is something I'll explain a little bit later. But so if my brain's continually going over this again and again, it's going to have negative impacts on my cognition. I'm not going to be able to think as clearly. I'm not going to be able to remember things as well because my body is in this stress mode. When I think about my trauma, my body is re-experiencing it in that moment. So my fight, flight, freeze response is going to come back on. And that prefrontal cortex, which is where we have our executive functioning skills, it's going to start shutting down again. And so I'm not going to be able to think as clearly, and I'm probably going to be in a bad mood. It doesn't feel good to think about this. So it's going to deplete my energy. It's going to make me a little bit more irritable and snappy with people. And this leads to more functional impairments. If I am not sleeping, probably because I'm having re-experiencing symptoms such as nightmares or just recurrent memories, I'm not going to be able to function as well that next day. Or if I'm scared of going to the parking garage, I'm not going to want to go to work and have to walk through that place every day. So it leads to more and more impairments in our life and less ability to kind of live fully. Some people also experience dissociation, which means not really inhabiting your body or being detached from your experience at the time. These dissociation after a trauma can last up to 72 hours after the event. So we could be numb, we could be just really looking like nothing happened to us, but inside there's this whole shutdown of our system. In addition to that, after a trauma, we are not going to be the same. Everything has shifted in our body. Our brain chemistry literally changes and has structural changes as well if the trauma is more severe and long-standing. So our relationship to the world, our relationship to ourselves, our relationship to the people in our life is going to be shifted from this. And it's really important to be aware of that so we can take responsibility to help ourselves redirect the relationship to be more meaningful to us and find a way to re-inhabit a role within these relationships. Different areas too impacted are our sense of safety, trust, esteem, control, and intimacy. We tend to have lots of feelings of isolation and difficulty experiencing positive emotions. Okay, so this is a nice slide that I think well illustrates post-traumatic stress disorder. It's not necessarily the diagnostic criteria of it, but it kind of gets at all those things I was talking about, the negative mood, avoiding places. If you have flashbacks, which is actually one of the least common symptoms of PTSD, all of these things are happening all the time to varying degrees for people dependent on the intensity of the trauma that they experience and the type of trauma that they experience. So we know that people who are in car accidents tend to have less trauma symptoms than somebody who's sexually assaulted. We know that there are some pre-trauma factors that can make people more susceptible to developing PTSD, and that includes lower socioeconomic status, less education, extreme experience of childhood adversity, child abuse, previous trauma exposure, or even family psychiatric history. In terms of the trauma, like I said, if the trauma is extremely severe, if it's reoccurrent, if it has multiple levels of trauma within it, such as witnessing your parent get hit and also being hit by your parent, such as in a domestic violence situation, those are going to increase your odds of developing PTSD. And after experiencing a trauma, we know that there are different things that help people recover. So when somebody tells you their trauma narrative, especially if it's the first time you tell them that, if you respond negatively in that moment, you increase their odds of developing PTSD because it's adding stigma, it adds shame, and it's going to make it harder for them to come to terms with what they've been through. So having great social support is very important post-trauma. And also paying attention to life stressors. If you have to move, if you are homeless, if you have a whole bunch of bills you can't pay, or even having to go through the legal process and recall all of this and have to answer all these really technical questions when you're trying to figure out what just happened to you and what is meaningful to you anymore, your odds of having PTSD can go up. And PTSD is actually often quite chronic for people. So there's some research that shows that if you develop PTSD, which is diagnosed 3 months, after in a trauma event, if you're having a certain amount of difficulty functioning and meet some criteria within the DSM, after a year, about 75% of people will still have that diagnosis. After 2 years, it's about 65. After 5 years, about 50% of people diagnosed with PTSD will still have PTSD. The average duration of PTSD episodes or experiences of like the high distress for people who have sought treatment is 3 years. And for people who never seek treatment, it's about 5.5 that they'll be highly distressed. Now, if we're talking about trafficking victims in particular, and when I say trafficking at this point, I mean sex trafficking victims, since that's where my research was. In my research, where I interviewed over 52 sex trafficking survivors or survivors of sexual exploitation, I found that there was no difference in rates of PTSD between short-term survivors, meaning that they had been out for less than 5 years, and long-term survivors who had been out over 15 years. So that means within the trafficking community, these individuals often stay highly traumatized from their experience and have an array of different symptoms affecting them all the time, which makes functioning in our society quite challenging, and trying to meet the expectations and demands for living well in what we call our society at the moment quite difficult. So COVID adds an extra layer of challenge for what survivors of sexual exploitation have been through. So triggers, I used this word before. I think it's pretty well known right now what it means, but just to kind of go over it, triggers are basically any stimuli that promote a recall of a previously traumatic experience. So it's often related to our senses. So what I see could trigger me, what I could hear could trigger me, but actually smell is our strongest memory recall. So that can be an extremely important trigger to be mindful of, especially when working with survivors of assault and sexual exploitation. If you think about it, how often do you just spray your cologne? And think of how many people maybe wear cologne. And if somebody was assaulted, or if somebody had a bunch of trafficking experience with somebody who wore a particular cologne, that could be a very big trigger for them that you might not be aware of, or they might not think of either, because it's so subtle how triggers can sometimes hit us. So trauma resiliency. So like I said, 70% of people will experience a trauma in their life, but only 1 to 3% go on to develop PTSD. More people will get depression, but in terms of PTSD, it's actually quite low. So why can some people adapt and other people can't? Well, that's where resilience comes in. And this is the process of adapting well in the face of adversity. It's the process of bouncing back and finding meaning within the terrible experience that somebody has gone through. And it's not necessarily a personality trait, although there probably are some genetic variables that would make us more or less able to be resilient after an experience. And like I said, all those pre-trauma factors, so at low SES, not a lot of education, and those kind of factors can also affect this. But most people can learn different actions that can help them be more resilient, and most people can find ways to develop the skills that they need in order to help themselves recover. So we're going to go through a couple of those different core elements that can help us learn our resilience. And one of those is connection. So really learning to prioritize relationships is very important. Seeking support from others, finding guides who have been through a similar experience can help us see our way out. This could be in the form of books, mentors, therapists, or really anybody who you feel safe talking to about what you went through, where you're not going to feel stigmatized for sharing the different thoughts and feelings that you have about the experience. Another element of this is common humanity. So common humanity basically means being aware that nothing that has happened to us has not happened to somebody else before. So we have unique variables to our own experiences, but somebody else has been in these shoes before and somebody will be in them after. And so if we know that, if we can remember that when we're suffering, then we can realize that there's guides and there is a way out of this experience. And I think that's really important, because when we're traumatized and we're afraid, we feel isolated from people. We don't find a sense of community because a lot of people around us probably haven't gone through it with us, which is why going through COVID is different, because we are all in this together, but everybody's having various levels of impact. So we can depend and look towards other people for support at this time. But if you're assaulted and nobody else in your community was, holding that feeling alone is very hard. So remembering that there's other people who've been there who will go through it and you can be a guide, and you have guides out there, is very important. The next one is really developing a healthy mind and healthy thinking style. So keeping things in perspective, looking for people to help challenge some of the beliefs that you might start to develop after that, such as the color yellow with that woman who was assaulted in a parking garage. It would be helpful if somebody in her life was like, remember, this is beautiful of the color yellow. Sunflowers are really beautiful and they're yellow. So let's remember that yellow isn't always abuse, and having to kind of repeat that over and over in your mind so that you can lessen the attachment you have between your trauma and that stimuli. It's also about accepting change. After a trauma, we will not be the same. We have to adapt to that new reality. So this means letting go and grieving the identity we were holding before, who we were before the trauma experience, and learning to embrace and support the birth of the new identity that we have. It's really helpful to maintain or find a hopeful outlook, finding something that you believe in, finding something that you're willing to put your energy towards, or finding some sense of purpose from your experience. How can you take this and use it to improve yourself or the world? It's also very important to learn from the past, and Viktor Frankl coined this term tragic optimism, which I think is really great, which basically means the human capacity to creatively turn negative life events or aspects into something positive or into constructive change. The last one that we're going to go over is meaning making. So this is, I've kind of referenced already, but it's helping others, it's learning to be proactive, it's moving towards your goals and looking for opportunities for self-discovery. It's taking what you've been through and saying, yes, this hurts, this isn't okay what I went through, and how can I help other people in a similar situation? Or what part of my experience can I connect to in a healthy enough way that I can share it with other people? So maybe it's a skill you learn after, or maybe it's just saying on Facebook, me too, and standing with that movement. It's finding some way to find your purpose in the cause of your trauma, or finding a way to be helpful in the world in another realm if your trauma is too much for you to get close to. So that was a lot, trauma information. So let's now move into trauma informed. So being trauma informed means being mindful of a person's entire history with particular consideration of the potential trauma backgrounds they carry and the resulting symptoms and coping mechanisms that can be the outcome of their suffering. We want to, when we're practicing trauma informed care, we first want to just say that we do care about their experience, and we're going to try to respond really kindly that they have suffered a lot and be mindful of that experience. This is recognizing that the trauma components are going to leave us with some symptoms and behaviors that feel that good. Maybe we're a little bit irritable. So when you go and when they come and meet you as their lawyer, maybe you're getting frustrated because they're being a little snippy or something like that. That might be a result of the trauma. Maybe you're talking about something that's really difficult for them, so they get irritable. And If you respond to that irritability with more anger, that's just going to keep them. But if you can find a way to say, oh, you know, this person has a lot of trauma, maybe this is related to their irritability at the moment. Let me just be mindful of that and maybe not respond from my own stress of them being irritable to me. Maybe I need to talk about it with them and say, hey, is everything? I see that you're kind of like irritable right now, and I just want to make sure that what we're doing is okay. So trauma-informed practice means putting the reality of the client's trauma and experience at the forefront of engaging with the client and adjusting the practice approach as informed by the individual's trauma experience. So one easy way to do this is to consider, like, what was the context of their trauma? If they were sexually assaulted at night, maybe this person shouldn't be taking night sessions with you only. So asking them, is it okay if we meet during the night? Or asking them, you know, would you meet during the day, considering their trauma? Another part of being trauma-informed, it means employing models of self-care to counter the effect of the client's trauma on yourself. Listening to trauma, talking to people who are traumatized, trying to deal with the topic of trauma on a daily basis is very challenging for us. So being able to take care of ourselves is very important, so we decrease the odds of vicarious trauma, compassion fatigue, burnout. If we want to be trauma informed, we have to be healthy. So we have to be taking care of ourselves. And we have to emphasize psychological, emotional, and spiritual safety for both ourselves and our clients in order to help the survivors rebuild a sense of control and empowerment. I apologize. We have a lawnmower going outside, so if you can hear that, I'm sorry, and hopefully it will move soon. Okay, so working with trafficking survivors who have been through trauma, it involves, I feel like I skipped a slide. Hold on. Okay, sorry, let's go back. So the 5 trauma-informed principles. We have safety, transparency and trustworthiness, choice, collaboration, mutuality, and empowerment. So safety is involving in the physical, emotional, psychological, and spiritual sense for the person. So making sure that they know where the bathroom is in the place, who's going to be around, what does the parking structure look like, does it feel safe for them to walk in there? Transparency means being clear, trying not to use as much legalese, being sure that you can understand what, and being very consistent and honest with what you're sharing. Not giving false hope is very important. But also finding things to be hopeful for is just as important. Choice. It's important when we're practicing trauma-informed care that we make sure that the choice is always in the survivor's hands. They get to decide at the end of the day what happens with the information, what happens with meetings. This is something that trauma survivors are often denied over and over again. So the more that you can put choice in their hands, even if they say, I can't make this choice, I need your help, it's empowering them. It's them be seen, it's helping them know that they're being respected in the situation. Collaboration and mutuality, so working together, it's not holding your power or expertise over them. This is really important because we know that we heal in relationships. In therapy, we know that 50% of whether or not a client has a good experience with therapy and improves is related to the relationship they have with their treatment provider. So if you want to be part of a survivor's healing process and you want to practice trauma-informed care, being kind, working together, and having respect in the relationship is an essential. And then empowerment is very essential as well. So giving them initiative, encouragement, options, encouraging their growth. This isn't coddling people or babying them, and that's really important to not practice, because sometimes I think when we're talking to people who have been through a lot of trauma, we get really nervous and try to use like really delicate hands, but it's about being honest, straightforward, and seeing their strength. Recognizing that people who have been through traumas are often stronger than people who haven't. They have survived something that a lot of people would not. And if we're talking about trafficking survivors, this is very true. To have survived an experience of trafficking is a feat that many of us might not be able to do. And that deserves a lot of respect, and it deserves a lot of recognition of the power that they have and encouragement to continue finding their own strength and power. Lastly, a primary goal of providing trauma-informed principles is saying that regardless of what your role is with them, the most important thing you're looking for is you're trying to assist the survivor in healing, recovering and healing from the experience that they went through. So when you're thinking about, do I need to have this extra meeting with them or not? Asking yourself, is it necessary or useful? And would it be helpful to them in their recovery from this experience? All right, so working with trafficking survivors. When we're working with trafficking survivors, it's really important to acknowledge the multiple and complex traumas that have occurred for them. There's typically familial trauma and abuse either ahead of time, or people are more likely to be trafficked by family members than anyone else. So just sit with that for a second. Your family member is more likely to traffic you than anyone else, meaning that you have betrayal by family members, you have familial abuse, and then you have other people coming in and abusing you. And there's probably sexual abuse, there could be starvation things going on. There's so many different traumas happening at the same time. So the fact that people are functioning at all is amazing and something to be celebrating. It's important to be aware of the particular triggers to the survivor, like I said earlier. So with trafficking survivors, asking a little bit of questions if it's safe and comfortable for them and you feel confident enough to hold that information. Being aware of their triggers. It's attunement to social inequalities, stigmas, and stereotypes. It's really, again, the importance of collaboration and choice, the value in valuing their dignity and respect, and it's tolerance of some strong or numb reactions. Trauma survivors might get really angry sometimes, and trafficking survivors might not have as good of ability to control their nervous system. Actually, a lot of people don't. But if we're really stressed out, our nervous system is going to be sending us all these intense emotions, and so we might react a little bit harshly, and we want to be mindful of that and okay if people need to storm out of our office because what we said was really triggering for them. And it's really important to have respect for the dissociation process, because if people experience a trauma early in life, or a lot of traumas early in life, they're more likely to have dissociative features, meaning they're going to be checked out or distant sometime. And their fight, flight, freeze response is going to be very active. Another response within this is called fawn, and that means identifying with the abuse or the abuser. So this is something we sometimes see with trafficking survivors, is that they think their experience was really good for them, or they find meaning within that, or they believe in what their pimp was saying so much that they have to identify with it in order to survive the experience. All right, gonna pass it over to Jamie now.
Thanks so much, Brittany. So I'm going to speak specifically about trauma-informed lawyering practices, although keep in mind that many of these practices apply with working with survivors, regardless of whether you're in a legal setting. The first is to be mindful of your meeting environment. It may depend where you work, what options you have, but think of, for our pro bono lawyers, we talk about if you work at a law firm and you have different options of what space you meet with your clients in. Some law firms have those big conference rooms that have glass windows on the outside, and it's kind of like being in a fishbowl. And people are walking by, and if somebody is telling you a really traumatic story or experience, that may not be the best environment to meet with them in. Or a big room may be really intimidating, whereas a smaller, intimate room might be more comfortable for your client. And giving them a heads up about what the space might be and giving them options. One thing that I'm mindful of is even just giving them choice over where they sit. Oftentimes survivors want to sit facing the door so they can see if anybody comes in or out. So making sure that you give them the option to control that. Also is understanding the power dynamic of, as an attorney, just being an attorney with a client in any setting, there's this different power dynamic. And with our clients, particularly, with Free to Thrive and other nonprofit attorneys or pro bono attorneys, we don't charge our clients for our services. And there may be a sense with clients of, what are you going to get out of this, and not understanding that, we're doing this, free of charge to support you. But there's just an imbalance of power. And so sometimes I'll even do small things to rebalance that power. So I may offer the client coffee or water when I first meet them and we're first sitting down to meet, so that it's showing that I'm here to serve you. Also, when we go over our engagement agreements, I'm very mindful to make sure that they understand that, they are hiring me, and just because they're not paying me doesn't mean that they do not control this relationship. They can fire me at any time, and that's okay. Making sure they understand that's really important. One element with working with this population is they tend to be, not everybody, but oftentimes they may be flaky. And so they may, meaning that they may show up late to meetings or they may cancel last minute. What we've often learned is that the further we get into their trauma history, if we start with, just general get to know you with a first meeting, and then the next meeting we start to dive deeper into their trauma history, they may start to become more flaky as we get further into their trauma history. And that's just it's a natural response to not wanting to talk about these things. And so just having other things to work on is something that will help you manage that situation. So you don't, like Dr. Greenbaum was talking about, so you don't get upset or frustrated with your clients, and just having empathy and understanding of, I wouldn't want to talk about these things either. It's really tough. And, having conversations with them, if you do start to notice that pattern about, we can take a break. We don't, we can, limit the length of our meetings, or we can take a break from meeting if you want some time. Obviously, depending on the nature of the case, some cases you're more able to do that than others. Also, maintaining professional boundaries is really important. Our client population may not be as sensitive to professional boundaries, and it's everything from, not talking about personal things with your clients, and, maintaining that, even, obviously physical professional boundaries as well. A lot of our clients like to hug me if they see me, and I just want to make sure that they're comfortable with that. I wouldn't, try to hug a client without them being okay with that, and just being very mindful of both physical boundaries and also just professional boundaries. And oftentimes clients will ask me personal questions, and I want to be honest with them. I don't want to be evasive and not, I want to get to know them, and I'm learning all this stuff about them, and I think they also want to get to know me. And so I try to strike that balance of answering their questions openly and honestly, but not divulging extra information. So, clients often ask me, do you have kids? And I'll say, no, I don't have any kids. And then I'll just continue on with the conversation, as opposed to elaborating why I don't have kids or when I want to have kids or anything like that. And finally, making sure that your clients have mental health support when they're working with you is really important. Depending on the resources in your community or within your entity or organization, you may or may not have access to those things, but knowing, what services are available in your community, even if that's not, if your organization doesn't offer therapy or mental health support, knowing who does is extremely important, because this process, no matter what you're doing with your clients, what kind of case it is, it's most likely going to be something that might stir things up for them or might be triggering to them. And so for them to have that support is going to help them through that process. It's going to help make sure that you don't end up taking on a therapist role, and it's going to make sure that your client has the support that they need to continue on with your case. In terms of meeting with your clients, one of the most important things to remember is inconsistencies in your client's story or lack of memory of something is a symptom of trauma, not a sign of them being dishonest. As lawyers, we are trained that, if somebody's story changes, from the first time you interview them to the next time, that's a sign that, they're not telling the truth. But the reality is with trauma victims, that's a sign that they are telling the truth and that they did experience that trauma. And it's important to find ways to help your clients get closer to remembering these things. Sometimes it's having therapeutic support. Sometimes it's helping them create a timeline. And if you notice inconsistencies, just address it with your clients honestly and say, last meeting you said this, and then this meeting you said that. Can we talk about that? And do you remember which is more accurate? And also saying it's okay if you don't remember. I know that was a long time ago, or I know that's a really difficult memory, and your brain doesn't want to remember that. Your brain is forgetting these things because it's a really difficult thing to think about, and that's okay. And we'll do the best we can in light of that. Certainly, making sure that you develop trust with your clients before delving into their trauma history as much as possible. For our criminal attorneys, that is going to be harder if you have to move forward with your case very quickly. But it depends on the case, of course. But really getting to know your client and really investing in them and showing them that you genuinely care about them, and helping gain their trust. And the best way you can do that is just be genuine with them and honest with them, and all the things that Dr. Greenbaum talked about are going to help you build that trust. But to the extent you can wait till you get to know them a little bit better before you get too deep into their trauma history, it's going to help a lot. Also, remembering not to ask questions that you don't need to know the answer to. Sometimes it's very tempting to, someone says something and you're like, you might say, if you hear yourself saying, I'm just curious, or I'm just curious about this, can you elaborate? If you're thinking that, oh, that's really interesting, I want to know more about that, and you don't actually need to know the answer to it, don't ask the question. And be mindful when you're asking questions. Is this something I really need to know right now? Can I wait? Can it wait? Do I not need to know the answer to this at all? And be mindful of how you're asking those questions, what details you're getting. How deep into that trauma history do you need to go to do the work that you're doing? Also, making sure that your client knows that you can take a break at any time, either when you're meeting or even, depending on the type of matter with your legal services. With us, when we do a lot of criminal vacature, which is helping clients clear their record. There's no deadline to file that case. So if it becomes too traumatizing or triggering for a client, we can take a break, and that's okay. We want to go at the client's own speed. And also making sure that you're giving clients a roadmap at the beginning of each meeting of, here's what we're going to do today, and at the end of the meeting, here's what we're going to do at the next meeting. That just helps them prepare for what's to come and know what to expect. And finally, exploring alternative narratives with your client is really important, and help them engage in problem solving. And finally, considerations for court. We had the same picture up in the trigger slide for a reason, is that just going into court may be an extremely triggering experience for your client, and being mindful that you may be comfortable walking into court. You may be in court every single day, or at least before COVID, you may have been. And so for you, it's just a normal thing to go into a courthouse. Keep in mind, from the second you get to court, going through security, having, you may have, people patting you down, or you have to take items of clothing off. That's uncomfortable. And then when you get into a courtroom, oftentimes when we're going to court, our client's trafficker or abuser is there too, seeing them, hearing them. We will sit as close as those chairs are to each other from that person's perpetrator. And it is really, really tough for your clients. And so you want to do everything you can to prepare them for that situation. So one of the things you can do is just to rehearse with them. If you can go to the courthouse ahead of time, even if you can't go into a courtroom, you may be able to go into an empty courtroom, or a courtroom with proceedings happening just briefly, so they can see what it looks like and know what to expect. But even just practicing, going to the courthouse, making sure they know where they're going to park, where they're going to go, meeting with them. Also taking safety precautions. We often have clients meet us at our office, and then we walk to court together, so that if their perpetrator is going to be at court, they don't see them coming or going. It helps them feel more safe and keeps them more safe. Or taking other precautions to make sure that your client is safe before and after court. Having people there to support your clients, whether it's a survivor advocate or a social worker or a support animal or a friend or family member, making sure that they have somebody there who they can lean on, because this may be a really hard experience for them. And if you can't have emotional support animals, that's an added bonus. And we talked about having your client work with a mental health professional in general. Certainly, if you're going to be going to court, your client may be so worried about court, they're not thinking, oh, I should make an appointment with my therapist for the day after court. But that's something that, is something to address with your client, is, have you met with your therapist lately? And I know we have court on Tuesday. It might be worth making an appointment with them for later in the week, so that you can debrief with your therapist after that day in court. Another thing is consider a trauma-informed, a trauma expert witness. A lot of the physical symptoms that Dr. Greenbaum talked about are things that jurors and judges and prosecutors may not necessarily know. So if your client has disassociated from the time of the incident for 2 days afterwards, and they spoke to police and they were totally flat, they weren't reacting in an emotional manner in the way that maybe somebody might think a victim should react, that's a sign of trauma. That's a sign that what they're saying is true. Whereas somebody listening to that account from a police officer may say, they didn't react, they weren't crying, they weren't upset, they seemed totally fine. So it's really important that you have that expert witness there to explain those symptoms. Also, with our clients, they're fight, flight, or freeze is more often than not is fight. So our clients may be involved in aggressive behavior that somebody who doesn't understand trauma would think, this is somebody who's a violent person. And the reality is that's their safety mechanism kicking in to keep them safe because of what they've experienced. And it's really important that you have somebody that can explain that to the court. And then finally, debriefing with your client after court on how they're doing and discussing, how they're going to take care of themselves. And also being mindful, we're going to have a whole nother training we'll talk about in a minute on vicarious trauma, but also taking care of yourself after court. If I know I have a really tough day in court, I will block off my evening to make sure that I take time for myself that night. But taking those steps to check on your client, whether it's right after court, maybe scheduling, just a little extra time in your schedule so that you can debrief with them a little bit and see how they're doing, maybe checking in with them the next day just to see how they're coping and talking to them about what next steps are or anything else. It will help them process what happened and help make it a less traumatic experience for them. And I'll turn it back over to Dr. Greenbaum to talk about staying trauma-informed during COVID.
All right, so similar to all the other trauma-informed principles, so we still want to practice transparency, choice, collaboration, and mutuality, and empowerment. At this time, though, it's really important to recognize that as the provider, we are more taxed than we usually are. We are operating more from a survival threat mode. We really can't go a day right now without getting several pieces of terrible news. So we're all very, very stressed, which makes us more irritable and more likely to act irrationally. So being attentive to your own mental health, knowing when you can't work for a day or need to take time off is really important. And that's okay to do. That's part of being trauma informed. So when you're having these days, it's okay to say to the client, you know what, I'm not in the best place to be able to do our work today. Can we put this off for a day? Or if we can't, practicing really good self-care as you're going into it. And if you know that the stimulus value or energy that you're giving off is different than what it typically is in your relationship with them, taking ownership of that and letting them know, I'm a little bit more drained and exhausted today, asking them how they're doing and asking them how it feels to have you be a little bit different than how you typically are. I read this great piece the other day by this doctor's Nancy McWilliams, and she said that her clients right now, as she's meeting with them through Zoom, for the first time are always checking in with her, how are you doing? Because they're worried about how she's doing and if she can hold the space for them as they're going through their own experience. So being willing to give a little bit in terms of that too, offering a little bit of honesty about, yeah, today is a good day or I struggled with this, but finding your hope and meaning and your way through it, demonstrating your ways of coping in a healthy way that you can share with them. Doing things that support regulation of your nervous system is very important. So practicing more mindfulness right now or meditation, doing some yoga, or just doing some good breathing throughout your day can really help your body's nervous system be more present and less reactive, especially when you're trying to meet the needs of other people. Like I said, when we're in these survival threat modes, our ability to think clearly and retain information is very drastically altered. So being a little bit more clear about the why and what is really important, and consider anything that you talk about that's really important that you need them to take away, following that up with written material so that they can revisit it at a time where maybe they don't feel as stressed. This is another time to continue sharing power and provide choice. So asking them if Zoom is okay or if they prefer the phone. That's a really important one. And being mindful too that Zoom is very exhausting. As we're looking at the Zoom camera, trying to read cues in each other's faces, all these micro expressions that we do all the time, we're not able to see, but our brain is continually looking for it, which makes it very, very hard to know that we're being understood in the way we want to and that we are communicating clearly. Also, our place of rest has become our place to work, or for some people it's always overlapped, so they have more training in that than some of us, but our home life balance is off. People are taking care of their kids as they're trying to do all of this work. So the toll you are taking is extensive. So be kind to yourself and be as kind as you can to other people as well. Additionally, it's really important to inform clients more of your confidentiality risks. I don't start a session with a client without letting them know the confidentiality risks I have. So I'll say, I'm wearing headphones so my partner can't hear you. I have the door shut. He knows to put on music or put on a movie or something if he can hear me talking. How does this feel for you? Does this feel safe enough to talk in? Sometimes they ask to see the room I'm in, to see that the door is closed. So I'll turn the camera around so that they can tell that there's nobody else in the room with me. Informing people of the risk of talking online. So we know that Zoom is HIPAA compliant, but maybe they don't. And there's the ability to record. So being very transparent that you're not recording when you're not. Or if you have to record, letting them know that you are and giving them permission to not have that recording shown or kept if they don't want it. And also being really attentive to the cultural experience of COVID. We know that different populations are being more drastically hit than others in this time, and being attentive to that in your relationship with clients is going to be really important to practicing trauma-informed care. So I am done with this slide. Good job, Jamie. I'll pass it over to you.
All right, so just about to wrap up so we can get into some Q&A. We do have our second part of this training on May 28th at the same time, 12 to 1 Pacific time. And we'll be talking about overcoming vicarious trauma, which is really about the impacts that working with trauma survivors has on those of us working with that population. So hope you can check that out. And then all of our upcoming trainings are on our website. And you can also see some past trainings there as well. So now we'll open it up to some Q&A and also have our contact information here. If we don't get to your question or if you have to jump off, you're welcome to contact us directly. So I'll turn it over to Nick Moore, who works with Free to Thrive, who's one of our staff attorneys and is going to moderate the Q&A.
Good afternoon, everyone. Thank you for such a great turnout, and we have some great questions here. The first question that I think we can answer is, Alyssa asks, can you share a best practice for survivor intake when working with a multidisciplinary task force? We want to minimize re-traumatizing, but also want to avoid potential ethical pitfalls that come with utilizing a centralized intake, which creates problems for confidentiality and privilege. Jamie, this is something that we deal with pretty routinely. You want to talk a little bit about some of our strategies?
Sure, and Dr. Greenbaum, you can jump in as well. I think finding that balance of what is the least amount of information that we all need. It's really hard to figure out in terms of number of people in the room, because oftentimes there's different parties that need to be a part of that conversation. But the more people you have in a room, the harder that is going to be for your client. And there's no right or wrong answer. You should tailor it to every situation. I mean, not knowing the task force, not knowing who's a part of this group, it's hard for me to say specifically. But I think being very mindful of getting the information that you all need, finding ways to share it confidentially so that, you know, if somebody isn't in that room for that meeting, they're getting that information and you're not repeating those questions is extremely important. It's something in the San Diego anti-trafficking community, we're still not where I'd like to be in terms of sharing of information. We are making a lot of progress and strides, but that's what I'll say. Dr. Greenbaum, do you have anything to add to that?
I think this, again, just goes to the trauma-informed principle. So being really transparent about who's in the room, why they're in the room, and what the intention of everybody in the room is. Or if you're talking about them having to do multiple interviews at different times, being really clear about what the purpose of all of those are, giving them options for when they're doing them. If they have to cancel at the last minute, that's okay. If they don't feel up for that day. And keeping everything very contained as much as possible. So I think you spoke to that quite well, Jamie. Thank you.
Rod asks a question that particularly hits home for me. He says, I'm an attorney representing youth in California's juvenile delinquency system. In the past 13 months, 15 of my kids are victims of sexual exploitation, and all of the youths revealed their traumas after I broached the subject. He's concerned about the proper way to bring up the subject because he's a large white man and he doesn't want to re-traumatize the kids. And as a large white man myself, I can tell you, I empathize with your situation a lot. These are difficult things to talk about, Rod. Brittany or Jamie, do either of you have some best practices for how to broach difficult subject matter with youth?
I can't speak a lot to the youth component. I don't feel like I should, because that's not the population I primarily work with. But I think when we present as somewhat intimidating in our approach, or if we just hold areas of privilege, it's really important to call those out. So to even say, you know, I'm a big white dude, like, what's it like to be talking to me about this? Do you feel safe with me? How close is it how comfortable are you with how close I get to you? Do you need me to stay back? And trying to look at your appearance and how does that come across to people? Are you walking with a lot of like intensity and kind of holding this intensity in your face that maybe feels intimidating, asking for feedback about that. How does my face look when you're talking to me? Do I get intimidating looks because I can't see me? I typically ask my clients to give me feedback all the time. If I'm making a face that doesn't feel good to them, I say, please let me know if my face ever communicates something that doesn't feel right, because I don't know what it's doing all the time and I want to take ownership of that. So if it's saying something, I need to know that. So asking questions like that and being respectful of it. So being willing to listen to their answer and take their feedback. If they say, yeah, you like come in so strong, it's uncomfortable, play around with your body image with them. Okay, so does it look better if I like lower my shoulders? Like, how does it feel safe for you to approach me so that you can keep softening your relationship with the outside world?
Yeah, that's
and in terms of bringing up difficult conversations with people, if they've told you about the trauma, that means that they're trusting you. And so that's already a really awesome sign. So thank you very much for being someone that they can trust. If you feel the need to keep bringing it up, or you think it's important to keep bringing it up with them, ask about it. Be like, hey, can we talk about your trauma today? Or, you said something to me last week that stuck with me. Would it be a good time right now or later? Could we check in about this? So giving them the choice to talk about it or not, but letting them know that you remember and care is important too. People forget about them. People forget about their trauma. So not being afraid to ask the question, to talk about it, or being sensitive to the fact that bringing it up is tough, but it's okay to do. We need to talk about trauma. We don't want to keep hiding it.
And the only things I'll add to that are, not knowing your specific work setting in terms of what other support you have within your organization or outside of it, but looking for other support is there a paralegal or somebody else who can be with you in those meetings? At Free to Thrive, we have a buddy system across the board, regardless of the attorney's gender or height or anything like that. It's just something that we feel, one, it makes our jobs easier to have one person talking and one person taking notes, but also I think it helps the clients feel a little bit more safe too, especially with an attorney who's not the same gender as them. So that's something to keep in mind. And also bringing in other supportive services. So are there victims advocates? Is there an organization that works with youth who can be a caseworker, a peer support specialist, anything like that you can bring in to support these youth while you're working with them? I find that really helps our clients.
Great. Susie Day asks, does how we support a victim of trauma differ depending on the specific circumstances of the traumatic event?
At the end of the day, no, you need to be kind. You need to follow good trauma-informed practices. But also, yes, in the sense of being attentive to, like, if they were in a car accident and that was their trauma, maybe they don't want to go and meet you so far away from them. Maybe you need to find a place that's a little bit closer to them. Or if somebody was assaulted in a big office building, maybe they don't want to meet you in that place. So if you can look at their trauma experience a little bit more detailed and be like, where might be trouble spots here? And then have questions about that for them, you can be attuned to what might be helpful for this particular trauma survivor. But like I said, at the end of the day, it's all about being kind and respectful of people's experience and empowering people and letting them know the choices that they do have.
Diane asks a great question about client control. Essentially, if you feel that someone is reacting irrationally and emotionally in a workplace because of trauma, how can you suggest that they get some help to recognize their own triggers and how to handle them in a different way? Jamie, do you want to speak to this?
I'll let Dr. Greenbaum go first. It's a tough question.
It is.
It's a really good question.
Yeah, so I think first it depends on the type of relationship you have with them. If you don't feel safe approaching them, don't. Go to the people who are higher up than you to manage the situation. Or if you are the person at the top of the line, consult with other people about the specifics of your situation so that you are using the most safe and trauma-informed approach possible. But also, if you have a good relationship with them, there's someone that they trust you and you feel comfortable approaching them, letting them know more about how you're responding to them in the moment. So it's not saying, oh, you're doing this, you're reacting emotionally, you're acting in this way. That's putting the pressure and blame on them. We want to build insight into how it's impacting other people. So I might say, oh, wow, like, I'm sorry, my nervous system is going off right now. Like, you're talking loud. And when I hear people like saying things really aggressively, or just maybe not aggressive, that's maybe not a good word for it, but intensely, it makes me kind of get nervous and I can't think as well. Can you hold on for a second? I need to breathe this out. And like, take a second to be able to hear what you're saying. So I'm going to put the focus on how am I experiencing what you're saying rather than how are you saying it. If you also have a good relationship with them though, and you've gotten into conversations about this a couple times, you at some point might be able to say, do you talk to people about this? Like, have you ever thought about it? It sounds like this is really stressful for you. So making sure you're coming at it with as much empathy and care for their well-being as possible.
Thank you. I think that's a great answer. And I just want to call out a couple of the other questions in the QA that I think touch on this, because Afra made a couple of comments in the QA that I think do speak to this. Understanding that the way we dress can also be triggering with certain religious symbology, and that there are grounding techniques that can be used to calm survivors and create a safe space as well.
We didn't talk a lot about grounding techniques. It's something that I highly recommend learning and practicing those. It's something that it does take practice to get skilled at doing them. And some may work better or for either you as someone using those techniques or for your clients. The reason we start with a breath at the beginning of this training and every training we do is because it really does ground you just to breathe. And there's a lot of power in that. I know Nick and I were walking down the street one day and we saw a victim of domestic violence who had just left court and had lost her children to her abuser. And she was so triggered and traumatized by that experience that she couldn't talk to us and she couldn't tell us what was going on and why she was upset. And so I stopped her and I said, I really want to help you. And I don't know what's going on. I see that you're very upset, but what I need you to do right now is I need you to breathe, because the only way that I can help you is if I can understand you. And so I said, can you just breathe with me? And this is a stranger walking down the street, and we just took a minute and breathed together, and it calmed her nervous system to a point where she could tell me what was happening and why she was upset. So I cannot express, like, for me, breathing is my number one, what calms my nervous system, and I find it helps people. So if you're in that moment with whether it's a client or a coworker, I like that.
I really appreciate you saying that, Jamie, because it is in breath that we can calm down our nervous system enough to have our prefrontal cortex, where our communication skills are, where all of this ability to recall information is. We can calm it down through the breath. And when we do breathe, we want to make sure that we're exhaling for longer than we inhale, because that's where we activate our parasympathetic nervous system, which allows our body to rest. So taking a shorter inhale, maybe holding it for a second and then exhaling, and just practice breathing with yourself. And in addition to that, practicing kindness, so doing an act of kindness for yourself or someone else, can actually help calm your nervous system down a lot too. And it's going to make all of these beautiful chemicals in your body go off, like serotonin, dopamine, and oxytocin, which will help calm your body down to help your cognition come back online.
So we are at 1:02. We are available to stay for about 10 minutes longer, and we can keep going through questions. I know some people have left, but a lot of you are staying with us, and we really appreciate it. So we'll go a little bit longer, but we understand if you do have to go.
Okay, and on that note too, I realized from the questions that I'm looking at that one of the 4 components of the trauma resilience was skipped in the slide. So I just quickly want to say that the 4 parts of them are connection, wellness is the one that was skipped, healthy thinking, and meaning making.
Excellent. A couple of kind of housekeeping questions. Brittany asks if there will be a certificate of completion or proof of attendance for her employer. I don't know that we do certificates.
If it's something like that, we can. We are not offering MCLE for this particular training. So unfortunately for the lawyers, this is more skill building and less substantive legal training. But if you need a certificate, you can reach out to us separately and we can figure something out, and my contact info is there.
Barbara asks, our county has a new legal team who are prosecuting DV and sexual assault cases, and is it possible for them to review this training to have a better understanding of victims of crime?
That is a great question, absolutely. So we will send out a recording of this to all attendees. We will likely also make it available to others after the fact. So yes, absolutely, please share this and please encourage them to join the next one. I will say that the next training after the second part of this is specifically for prosecution and law enforcement, and It's focused on identifying trafficking victims among the DV population. So I highly recommend encouraging them to participate in that training as well. And that one's going to be on June 5th. And it's on, I believe it's on our website already. If it's not there, it will be soon.
Okay. Erica asks, does Free to Thrive offer pro bono legal services to survivors nationwide or in a specific area? She works for the National Human Trafficking Hotline and would like to share this resource with her callers and survivors if appropriate.
Well, thank you so much for the question. Thank you for participating and for the work that you do at Polaris and as part of the hotline. Our focus area is on San Diego. We are part of a nationwide network that actually just formed recently called the National Survivor Law Collective. We are in the process of developing and launching what this is so that we have a nationwide referral network. If, certainly for anybody on here who needs to find a lawyer in another community, you can reach out to Free to Thrive. If we can't help your survivor, we will help you find someone who can, but ultimately our hope is that this network becomes that space where people can go. More info on that to come soon.
Seth asks a great question we've been talking about internally for the last couple weeks. Are there specific referral sources that are important to know about if one is interested in providing mental health services, and is funding or coverage typically available if pro bono isn't a viable option? Brittany?
Yeah, this is a problem. We need more specific trauma-informed, trafficking-informed therapists out there, and we need more free resources. So at this time, I would look to the different local organizations that are doing trafficking work in your community and seeing who they know. But this is something that we are trying to get off the floor so that we can have a good system of referrals for people who have experienced these types of traumas.
And as Nick alluded to, this is an ongoing conversation of ours, is how can we build that capacity in our community for our clients, because there's a huge need for it, and there are very few trauma-trained expert therapists. One thing to note, that if you are in California, victims compensation will cover therapy as one of the things that you can get compensation for. And basically a victim would apply, they would get approval from the victims compensation board, and then the therapist would be able to get reimbursed for those therapy sessions up to a certain amount, but it's actually a pretty large amount. I believe it's 40 sessions. So that's something, if you're in California, I would highly recommend using that. And if you're not in California, see if your state offers that. And if not, I would recommend looking at other organizations in your community, either trafficking specific or more broad organizations that may offer therapeutic services. And if you aren't aware of any, then I would call the National Human Trafficking Hotline, and hopefully they can point you to some. I will say in this moment, with people being more open to teletherapy, I know rules are being loosened a little bit about teletherapy. I'm really hoping that that will expand this service for our client population.
Great. Alicia asks a question: if a client has trauma dealing with women specifically, do you work through that, or do you reassign them to a male attorney? And I could imagine that could also apply to a therapist, and then vice versa.
So as far as Free to Thrive is concerned, we always speak to our clients about if they have a preference in terms of the gender of their attorney, and are mindful of that when pairing them with an attorney, whether it's a Free to Thrive attorney or an outside attorney.
Yeah, and same with therapy. We ask, who are you comfortable working with? If they have any particular demographics that they feel more comfortable with than the other, we're going to try to meet that to the best of our ability. And if there isn't anybody else, it's having conversations about that and recognizing yourself as a source of a trigger. So I recognize that there aren't other female therapists or male therapists available, and you would prefer to work with them. What is that like for you? What are the fears that you bring into this relationship? And it always gets to be, as much as possible, the client's choice. So they get to decide. So you're not making that decision for them. So it's not on you. It gets to be them who says, I would prefer this if possible.
And I think we have time for one more question, Nick.
Now I have some pressure because there are 11 open questions here. And I apologize to everyone. If we do not answer your question, please feel free to email us. Our contact, Jamie's contact information is up there. We would love to talk to you. We'd love to answer your questions. I'm sorry, I'm having a hard time choosing just one. I'm reading through these again. The one at the top of my list, Samantha asks, can you talk a little bit more about alternative narratives? And I guess it's not a Well, Brittany, can you talk a little bit more about alternative narratives?
I know that Jamie put this on her slide for talking about doing the trauma-informed lawyering. I think if I remember correctly, what we've talked about it as, it just means like finding a different way for them to tell their narrative if telling it in a linear, straight way is not possible for them. So if they can't tell their narrative, finding if they can answer certain questions related to it or things like that. So it's just like creative problem solving around it.
Yeah, and just to add to that, I often just think about, there's the story that we tell ourselves about our experiences, and it's the, a lot of, it's been the ego, it's anything, it's that story that our mind tells ourselves, but there's different stories. And oftentimes, reminding our clients of that this isn't something that you chose, this is something that happened to you, and helping them look at their experiences just in a different light, thinking, just, yeah, just looking at, it's hard without, I can't think of a specific example right now, but just kind of telling themselves a different story about those experiences than what their mind wants to tell them.
Okay, I want to end with one last question. I know we said this one was the last, but Tim Nader says, Jamie, Dr. Greenbaum, thank you for one of the best presentations, if not the best, I've attended as a lawyer. Are there programs already instituted within our court system to improve the treatment of trauma victims in court?
That's a great question. And hi, Tim. Thank you so much for participating and for your kind words. I really appreciate it. That's a good question. I know this is something that in terms of trauma lawyering, even as a term of art, is a very new thing. I don't really know how long it's been around. There's some writing on it. There's some research. There's some classes, but very, very, very little. And so there's not a lot of resources working to change that in San Diego, of helping our justice system and our legal system be more trauma informed with trainings like this. But the answer is, I'm, at least in San Diego, I'm not aware of any. I'd love to hear from others in other communities what there is. There's certainly people are trained on trauma and working with trauma victims, but I find, it might be like for example, in our law enforcement, our human trafficking task force gets training on working with trauma victims and human trafficking survivors. I don't know that across the board, our law enforcement agencies are getting training on trauma. Of this basic training that we're doing today, I don't believe they get this kind of training. I could be wrong, and I apologize if I am, but I haven't heard of it. Or training specifically on human trafficking. I know they get a little bit in their academy, but it's a tiny little bit, and it's not an ongoing thing. So that's why we offer these trainings, and why we're offering one specifically to law enforcement on June 5th. That's going to law enforcement and prosecutorial agencies. But in terms of having, I do find, unfortunately, when I get in the courtroom, I find that more often than not, the prosecutorial agencies, the judges don't understand trauma and don't understand, what I talked about of how it manifests with our clients, and those preconceived notions that we all have of, they're being inconsistent, therefore they're lying, or they weren't reacting, or they were being violent. All those things are things that we're taught to think a certain way, and it's completely contradicted by what we know about trauma. And more often than not in the court system, I find that those around me don't have this basic understanding. So something I'm very much looking to change.
I would also say just that the trauma-informed work in court is generally centered around children. So like our juvenile court systems, the courtrooms have toys and kids' books in them and things like that. When children are being compelled to testify, for example, in a criminal matter, they do have the option of having support or therapy animals. And in the family law process, children who are victims of trauma, generally would get appointed minors counsel that would be compensated by the state or the county. But the examples for how the court handles trauma victims are almost exclusively centered around children.
Yep. So we have a lot of work to do, but we have an incredible bench here in San Diego that's really open to that, and incredible, both our city attorney's office, our DA's office are very, in tune with these things and are, open to these trainings and have been participating in them. So we are growing that. And even our probation office, did a training with us, and it was great. And it was one group within that. I want to train the whole office eventually, but little by little, we are starting to chip away at this. Thank you all so much for being a part of today's training. We so appreciate it. We look forward to connecting with you offline, and keep in touch with us, and hope you'll attend our next training. And thank you so much, Dr. Greenbaum, for bringing your expertise to educate all of us. And thank you, Nick, for your great moderation. Take care, everybody. Be safe, be healthy, and we'll see you soon.
Thank you.
Bye.
All right. Bye, y'all. I got to get going to a client.
Bye. Thank you so much.
Yeah. Thanks, Jamie. You did too.